Right, this exercise is to check for how mobile the hips are. We want to make sure that if we do have issues with hip mobility that we address them, because if the hip is not mobile, it means that the pelvic floor is not going to be mobile. So on the right side, we will see people push off to the right, and so we do a slightly different test for rights and lefts. So for the right hip, we get the right knee onto, this can be an ab mat, it can be a plate, it can be a rolled up towel or a cushion. This is going to depend on how much movement they have in their hips. If they don't have a lot, then something lower to the ground is going to be better. If they can tolerate a little bit more movement, then something like an ab mat or a yoga block. And what we do is to get them onto all fours, so their knees are in line, the left knee is on the ground, and we're going to drift off to the right. And we're going to stay here for the whole of this movement. And then what we're going to do is we're going to get them to pick up their left knee. Now the driver in this movement is the hip, but sometimes when we cue the hip, they can't move it. And then the knee and their foot are coming out. So we just say, pick up your left knee without the foot moving upwards. So the foot and the knee are going to be in line, drive off, and they're going to lift up their knee, right? And then they're going to come back down. So from the side, that will look like this. Drift off to the right, and they're going to just pick up that left hip. All right, and then they're going to drop it. Now all the time they're driven off to the right, and we're going to cue breath for breathe in and breathe out. And we stay driven off to the right. So it looks like this the whole time. And they should feel their glute start to talk to them. What we're looking for is a hip that can move, that's not getting the back to help it. As in, when the hip moves, it doesn't look like that. The whole back has to come up to help them. Rather, it's just a hip that can move. Right? So it's a hip that can move, rather than the whole back having to help.